Hello and welcome to the chat room, your venue for learning how to apply health analysis to real-world problems. I'm Jason.
And I'm Jennifer.
And in this chat video, we hope to get you excited about cost-effectiveness analysis, one of the fastest growing fields in health research. We'll explain exactly what it is, why it's so useful, and how chat will serve as your go-to resource for not only acquiring knowledge about cost-effectiveness analysis, but for harnessing the applied technical skills necessary to design, conduct, and interpret your own CEA. CHAT stands for Community Health Analytics Training. Who's the community? Well, that's all of you. We serve a very broad and diverse community, from public health, medical, and business students, health economists, biomedical researchers, healthcare providers, and epidemiologists like me, to those of you who might work for a county or state health department or an international health NGO. Why health analytics? Well, two reasons really. First, health analytics encompasses technologies and skills that are used to deliver key insights into an extremely complex, interdependent health arena that impacts health outcomes, costs, and healthcare quality. In essence, health analytics are extremely important across the globe. Second, despite its utility, few people understand what health analytics is, and even fewer have the skills and confidence necessary to use it in their organizations. It is then through training that we hope to fill this void, providing you with tangible, practical expertise in health analytics, and the world with a critical mass of functional analysts in the workforce.
And it's not just your normal training, Jason. Chat is not intended to provide you with a series of narrated PowerPoint slides or some screenshots of commonly used software. Our experience is that those efforts are ineffective and fail to result in any real increase in health analytics being done in the workplace. Instead, we intend to atomize learning and pair your cognitive skills with motor skills. How, you ask? Well, we enhance content with a visually stimulating environment that is grounded in actually performing tasks in health analytics. Much of the workforce is dominated by busy professionals with fragmented time and who may be hesitant to tackle such a seemingly insurmountable hurdle. Through chat, we aim to eliminate the monotony and mobilize more than one area of your brain, which will enhance your ability to assimilate, recall, reproduce, and implement specific analytics skill sets that are meaningful to you and your current or prospective industry. Sound good? Well, let's get to it. Jason started this video by stating that this particular chat course is focused on cost-effectiveness analysis in health. At its core, cost-effectiveness analysis is an art you will master that facilitates the ability to make decisions. That is, to decide between different options that are available. These decisions can be made for you, for your company, for an industry, for a nation, or for an international initiative. And notice I said facilitate the decision-making process. That doesn't mean you necessarily make the decision, but you will be well-versed at providing the evidence upon which a decision will be based. So what does decision analysis look like? Well, let's consider a simple example everyone is familiar with. A decision that involves what to do with your own money. Let's say a friend just gave me $10,000.
$10,000? What kind of friends do you have?
Okay, never mind. Let's say I just got a $10,000 bonus from work after working really, really hard for it.
That's better.
I was thinking about just putting my money in a CD that will gain 5% over the next year. But there's this stock my financial advisor recommended, and I've been talking for ages about my dream of opening my own tech business.
So you have options?
Yep, 3 of them.
And you need to make a decision?
Yeah, which option is likely to be the best investment?
So this is perfect for a decision analysis model involving cost. Here's a visual schematic that constitutes the most basic of decision analysis models and that describes your conundrum perfectly. Your decision is right here. How should I invest $10,000? Then, emanating from what is called the decision node, are the 3 investment strategies you're trying to choose between. You can either put your money in a risk-free CD paying 5% interest, purchase a moderate risk stock your financial guru recommended, or throw the money into a high-risk business venture. Now, in order to make a decision, you'll need some additional information, right? We need to know, or at least have some sort of guess, as to the possible events that can take place with each option, the chances that each of these things will happen, and the aftermath in terms of money gained or lost with each event pathway. These pieces of information, these estimates, are at the heart of any cost or cost-effectiveness analysis. In this case, the CD is a no-brainer. There's only one possibility. You put the money into the CD, and after 1 year, you've made $500. No more, no less. With the stock option, your financial advisor has told you that there is a 30% chance that the company will do really well, and if it does, you'll make $5,000. There's a 40% chance that it'll do a little better than average and make you an extra $1,000 in the next year, but there's also a 30% chance that you'll end up losing $6,000. Now, you've done your own research on tech companies in the past 5 years and told me you have about a 50% chance of making about as much as the CD if your company begins to gain some traction, and a near 10% chance of tripling your money in the first year if you've identified and secured your own niche in the market. Unfortunately, there's also a 40% chance that the company will fail miserably and you'll lose everything. But there's always that 1 in a million chance you'll be the next Google upstart and make $1 billion after being bought out by, you guessed it, Google. Hey, it happened for the developers of YouTube and the former Google Maps competitor Waze. And yes, we can actually build into the model that 1 in a million chance probability. The question becomes, based on all of these best guess estimates of the things that could happen, the chances they will happen, and the money you'll gain or lose if they happen, what's the decision that on average will make the most money? Now, I've created this simple decision analysis model, or decision tree, in software known as Triage Pro. It's not only good for making pretty sketches, but also offers an extremely powerful array of analytic and graphical tools you can leverage to perform from the most basic to the most complex cost-effective analyses around. Although there are a number of software options, our experience is that Triage Pro has been designed to implement the techniques of decision analysis, which include CEA, in the most intuitive and easy-to-use manner. Therefore, we'll teach you the applied art of conducting CEA through the eyes of Triage. But, of course, the principles, techniques, and interpretation will translate into any other software you choose. From our decision tree, I will click on the decision node and then perform what's called a rollback by clicking on the little beach ball icon up here. Because I've already specified my model so that it returns the investment strategy with the highest estimated monetary gain, you can see it's actually picked the risk-free CD. It also gives you insight as to why. It knew the CD would always make you $500. On average, the stock would make $100 and your dream business would lose $750 of your initial $10,000 investment. So based on the probability and payoff estimates, I've supplied you with the information to facilitate a decision. The actual decision would be up to you.
And what's really cool is that we can see if the most financially sensible investment strategy would change if we got the model inputs wrong. For example, we originally said that the chance of my stock doing just okay was 40%. But what if it were actually 50%? Would that make a difference? Let's see. Yes, with just this small change, it estimates that the expected return on my investment is $800, which is more than the $500 I would make with the CD. So now, I should be inclined to invest in the stock. And what if instead of a 1 in a million shot at striking oil, it was a mere 1 in 100,000 chance? Then, my dream of starting my own tech company makes sense. In fact, there are cool graphical tools that tell me the point at which the optimal strategy changes. Here, we have a simple graph that shows the expected value or expected monetary gain or loss with each strategy. Keeping all our other estimates the same, we wanted to see what would happen if we changed the probability that the business venture strategy will find a niche in the market and make $20,000. We look at all the possibilities from a 5% chance to a 15% chance. The strategy we choose is the one that has the highest expected return. So you can see that with the 5% chance of making $20,000, the business venture would lose money and is, by far, the least desirable option. But as we move towards 15%, it becomes more attractive, and here at 14.2%, it becomes the option that is likely to yield the highest return. Pretty cool, huh? You can really use decision analysis for anything. Take a look at this decision. How do you become a famous singer? Here, my desired outcome is the number of records sold in the next year. I want to choose between trying out for American Idol, trying out for the X Factor, and performing on YouTube and in local bars, the old-fashioned way. The idea is the exact same. We design a model that sketches out the series of events associated with each strategy for becoming a famous singer. We then estimate, based on our research, the probability of each event happening. At the end of each event pathway, we specify a payoff, which in this case is the expected number of records sold. For example, you have a 1 in 500 chance of making the local cut for American Idol, then a 1 in 250 chance of making the regional cut, a 1 in 50 chance on the show, and a 1 in 20 shot at winning. That's actually a 1 in 125 million chance of winning. But if you follow that path, the payoff is big. You'd sell 5 million records. And that's the way it works. You place your estimates in the decision model, click on the beach ball, and here it says you should suit up and harmonize for X Factor. But notice that the average number of records sold under each strategy is less than 2. So I wouldn't get too excited.
Hey, I disagree. What about me, the voice of an angel, with moves like Elvis?
Voice of an angel? Okay, but you do bring up a valid point. Not about your voice, but about every decision relying on the inputs, those probabilities and payoffs. If you really do have such a unique and desirable voice, then these probabilities would likely be more in your favor, and perhaps the 1 in 125 million chance of winning would be more like 1 in 50,000. That could change everything, including your ultimate decision.
So by now, you can appreciate the utility of decision analysis models in helping to make decisions. But in chat, we are focused on health analytics. So let's look at a more practical example. Here, we need to decide on the most cost-effective way of treating a particular disease. The current standard of care is to take a drug every month. As you can see, the drug is 50% effective at eliminating the disease if taken with full compliance, and it has no adverse side effects. But we now have a new nanosurgical procedure that even in the absence of the drug improves effectiveness of disease eradication to 75%. Our final option is to combine the drug and the surgery, which clinical trials have shown improves effectiveness slightly over the surgery alone. The cost of the drug is $20,000, and the cost of the surgery is $100,000. If the treatment is ineffective and the disease progresses, it costs an additional $8,000 in hospital costs. If the treatment is effective, the costs of medical care are deemed negligible for this example. In this case, we also have an additional number to the right of the cost for each event pathway. This is the measure of effectiveness. Remember, this is cost effectiveness in health and medicine. This is what we are most interested in because it's about people's health. Regardless of the treatment strategy, if it proves effective to eliminate disease, the anticipated life expectancy is 10 years. If it does not, life expectancy is only 2 years. So which strategy is the most cost effective? Well, a rollback reveals that the new surgery, without incorporation of the drug, is the most cost-effective strategy. Very soon in this course, you will learn the why behind this decision. For now, just marvel at the possibilities decision analysis modeling and cost-effectiveness analysis have to offer. And I haven't even scratched the surface on the graphical and tabular tools we will dissect in detail.
A very natural question you might be asking yourself is, despite all this fancy terminology and software, why is all of this even important? Why do we even consider costs? In our example, the drug plus surgery strategy was the most effective. Here, on average, it extends life 8.16 years. The surgery alone only affords 8 years exactly. We should want the most effective treatments and interventions, period. Why are we even debating cost or affordability when we are talking about human lives? We shouldn't decide who lives and who dies. Isn't that unethical? It really is an excellent question, and one that makes CEA extremely controversial to those who do not understand its intended purpose. In fact, during this course, you will learn that it is actually unethical not to have CEA-informed decision making. Why? Well, we don't live in a world with unlimited resources. Here in the United States, we spend more than twice what any other country spends on healthcare. But we rank in the middle of the pack among developed nations on key health indicators. So, high expenditures do not always translate into quality care. But what about developing countries whose budgets for even basic health services are meager at best? Imagine you are the head of a village in a developing nation whose annual healthcare budget is only $100,000. Highly advanced surgical procedures for rare brain tumors are available, and cost-effectiveness analyses reveal that it costs approximately $90,000 per quality-adjusted life year, or QALY, a measure of effectiveness we will revisit throughout this course. Conversely, a course of HIV treatment costs $10,000 per QALY. Mosquito nets cost $1,000 per QALY. Water purifiers $700 per QALY, and the measles vaccine $45 per QALY. You could spend 90% of your annual budget to gain 1 QALY by adopting the new surgical procedure for brain tumors, or you could use the same $90,000 to purchase doses of the measles vaccine and instead save 2,000 QALYs. By deeming the surgery as not cost-effective, is that unethical? The answer will always be, it depends, but in this case, I think it is clear how CEA can offer meaningful information to decision makers. Regardless, rest assured that the provision of healthcare is plagued by ethical dilemmas.
We want to leave you with the feeling that you are embarking on a new adventure that has real-world applicability and a demonstrable and quantifiable impact on people's lives. Let's see what kind of investigations cost-effectiveness analysis is currently being used for. We start in Kenya, where a 2013 study investigated the cost-effectiveness of providing insecticide-treated bed nets and point-of-use water filters to a specific population of HIV-infected adults. Researchers scoured multiple sources for estimates of inputs, including a multi-site study and the published literature, which is common. They found the two resources very cost-effective, only costing $3,100 to avert a single human death. This became a supported provision in Kenya shortly thereafter. Next, we move over to Ireland, where investigators use CEA to decide between 4 different strategies for preventing hepatitis A. We chose this study because it's an example of how the most cost-effective strategy may depend on the characteristics of the population. Here, vaccine was the best choice for communities with a low level of Hep A immunity, but a screening first approach followed by vaccination was better when dealing with populations in which immunity was higher. In India, researchers considered implementing breast cancer screening, but were concerned that it would detract from resources that could be used for other health interventions. They ran a microsimulation, which is a specific type of cost-effectiveness analysis you will be learning about in more advanced chat videos, and determined that clinical breast exams were more cost-effective than mammography in a manner similar to developed countries. However, they conclude that despite this information, the decision makers felt the introduction of screening in India would represent a greater challenge and could not be chosen over competing health priorities. This is a good example of how we are simply the providers of evidence. It's up to the decision makers to, well, make the decisions. Last, This is an excellent paper that uses CEA to determine optimal strategies for improving the health and well-being of some of Africa's most vulnerable citizens, mothers and babies.
And Jason, as you can see, even the World Health Organization, the directing and coordinating authority for health within the United Nations, through its Who Choice initiative, firmly backs the use of CEA for strategic planning and policy decisions. The impact of CEA is felt around the world, and the scope of health interventions and health outcomes studied is enormous. So CEA is on the rise, and through chat, you will be well positioned to inject CEA into your work and contribute to choosing interventions that achieve the highest level of impact on the longevity and quality of life within a world of resource and fiscal constraints. There is just so much more to come. I hope you're all excited. I know I am. But until next time, this is Jennifer.
And this is Jason.
Signing off.